All right. Hi, everybody. My name is Rachel West, and I'm here with Sean Carney. I want to welcome you to the first in a series of webinars. This one is Focus on Culture, Easy, Meaningful Ways to Retain Nursing Staff. And we're so delighted that you're here. I want to just go over a couple of quick housekeeping items before we get started in earnest. The first thing I need to mention is that this webinar is going to be recorded so that you will have access to rewatch or, maybe you missed something during the presentation and our conversation. It will be recorded. It will be available. I put in the chat the link for those of you who are nurses who want to earn your zero point 0.5 contact hours for attending this webinar. Head over to edu.intellicare.com and register under the course shell for this webinar. Complete the evaluation like you have to do, and your certificate will be immediately available. Of course, we want to hear from you. So if there are questions or comments, or maybe you even have a great suggestion you want for a new webinar to be considered, please drop that in our chat as well. I put my email address, and Sean, I volunteered your email address in the chat as well, so that we want to just keep this conversation going. So do reach out to us. We'd love to hear from you. And so on. So that's the housekeeping business. I'm just going to do a quick introduction so you know who I am and why I'm here. And then Sean, I can't wait to hear from you, and you can give yourself a bit of an introduction as well. So my name is Rachel West. I am the Director of Education at IntelyCare, and I oversee IntelyEDU. I'm also a nurse. I've been a nurse for 23 years. Can't believe it's that long already. But here we are. And my passion and focus and expertise really lies in education and helping to pre-licensure all the way through now post-licensure, upskilling, retooling, and refining practice. So I've been with IntelyCare a few years now, and I'm so delighted to be here. All right, Sean, why don't you give us a bit of an introduction? Sean's our VP of Partnerships. Go ahead,
Thank
Sean.
you. Thank you so much, Rachel.
Sure.
I am a former nursing home administrator, owner operator. Was originally licensed in 2003. I've held various positions in long-term care, such as nursing home administrator, executive director in assisted living, regional director, and I was an owner operator of facilities this last couple of years.
That's wonderful. That's wonderful. All right. So, again, today our big focus is to really think about, culture. And I think sometimes when we think about culture, that can be a really big, abstract, kind of nebulous idea. What is culture? Maybe we've even heard that term sort of thrown around a little bit. And what I think our focus is today is to really think about a couple, maybe 3 or 4 real key takeaways that people can use if they're in a post-acute care facility setting. But I think this also, I would challenge us to imagine that this also applies to ourselves as providers and practitioners, and in any healthcare setting. So while we're focusing on post-acute care, imagine that this could really be something that you could take out even into your day-to-day life. So first, our first question, what do you think, Sean, really we need to focus on if you are an owner operator or you're a leader, either in an actual position or not, to improve and really build a culture that you would be happy and proud to have in your building?
Sure. First and foremost, I found throughout my career that culture development has been a key metric in the success of any facility or any group of facilities that I've ever been involved with. Uh, and that culture development is an ongoing process. You can enter that process at any point when the culture is high and when the culture is not necessarily at its best. And there are a few things that you can do to make some real improvements when that is needed. And there are also some things that you want to concentrate on to maintain a high level of culture that a facility may have already embedded in it. The reason why I find culture so vital is it really can make or break the success of that facility. The culture of the building or a group of facilities is all encompassing and it affects all aspects and all facets of the building. And most importantly, or a way to look at this is the cost to benefit ratio of developing a positive culture within the facility is in good balance. It takes very little resources with respect to finances to develop a good culture, but it does take a lot of hard work, effort, and a plan to
Yeah.
execute on.
That's a really great point. I know as a person peripherally, not as embedded maybe as you are and have been in post acute care, that buildings run on a razor thin line. The margin is very small. And so thinking about ways to, make a meaningful impact, not only on maybe retaining a happy staff, but extending that a little bit further to imagine how that happy, consistent staff, we know that from research, we know that from our own personal experiences, that when we have a consistent happy staff, the quality of care goes up. And so not investing huge dollars to make that happen is really powerful.
Absolutely. The health of the culture of your facility directly impacts the staff retention, the census management of the facility, and then most importantly, the combination of those two things to deliver the quality of care that you're looking for. That is a metrics that we have to strive for on a day-to-day basis, and the converse, an unhealthy culture will drive staff away from the building in an environment where we are struggling to retain and maintain the high level of quality within the facilities. It affects the ability to fill beds because that culture is seen by your stakeholders and the community at large. And these things all, again, come together and affect the quality. And with the new reporting tools that are out there, pre and post COVID, we all know that your star rating, your survey results, these are things that are public knowledge, and having a positive culture within the facility has a direct effect on all of this.
Yeah, that's really great. That's great. Absolutely. I think you're spot on there. So if we could maybe imagine three things, if we could boil it down to three things, and once we, sort of peripherally talk about them, we're going to sort of maybe take a deep dive into each one. But if you had to pick three things that were really simple but meaningful to impact culture, what would those be?
Off the top of my head, I think that the first one would be developing trust amongst the associates, the residents, and the stakeholders in all departments. The second would be establishing an open door policy with some structure and boundaries around that open door policy so that it can be productive. And then the third would be creating value statements or value propositions for each one of the stakeholders within the community, meaning each department and all the associates that are working within the community, really diving into understanding what their value is to the facility so that they feel empowered to come to work every day, feel empowered to make a difference in the care of the residents, and really just uphold culture and values that a facility or community is striving for.
Awesome. Okay, so those are three great things. So let's first talk about trust. Trust is definitely something that is hard to earn and easy to lose. So, I think that if we start from a place knowing that we have to build trust, I think that you have wonderful experiences. So I bet you have an example you can share with us about how you could maybe foster building that trust.
Well, to your point, Rachel, building trust takes a lot of focused effort.
Mm-hmm.
Destroying trust takes 1 minute, one statement, one decision that is not in line with the values of a community or the leadership in the community. So it's something that has to be truly worked on. Um, one of the ways, and I'm going to tie the two together, is developing trust is respecting and utilizing the structure of that open door policy. Whereas when somebody comes in and identifies an issue that they see needs to be addressed,
Mm-hmm.
you really have to let that first make them feel welcome and invited to come into your office or wherever you are. Make sure you're available to them,
Mm-hmm.
um, to have that conversation, empower them to speak freely. Um, And that leads back to some of those boundaries and structure that you set up,
Mm-hmm.
because one of the great ways of doing this is setting up a structure where when somebody comes into your office or comes to you in whatever setting, you're making sure that it's private. You're making sure that they understand that once they come to you with a problem,
Mm-hmm.
you're really expecting them to come with a solution to that problem, a well thought out solution. And if they do that and they open up that vulnerability to come and have that conversation with you, you have to be ready to react to it, and you have to be ready to implement it, and or maybe have a longer conversation with that person as to why their solution may or may not be in line, and then let them work with you to come up with a meaningful solution that can be carried out.
Yeah.
So there's many steps here. The last one is keeping that information private, or at least to the group that is necessary.
Mm-hmm.
If people feel like their conversations, their thoughts, their ideas are not safe when they come to you or to any employee within the facility or associate within the facility, that trust gets broken very quickly, and then that becomes the rumor mill, and the rumor mill uh, erodes efficiency and
Yeah.
work production. Then it directly relates to staff retention, and then straight down to the care of the residents. So it's a cascading effect.
Yeah, yeah, definitely. I really like what you said about, empowering the workforce to, you know, come to people who are traditionally in positions that we associate with power, right? We imagine a hierarchy sometimes in all of our lives in all of the different places, but to really challenge that hierarchy is, I think, what I heard you say, and really empower people to say, look, come talk to me. I want to hear what you have to say. Maybe you have a solution. I hope you have a solution. If you have a solution, I want to hear it. And then let's see, whether we can do something on it now, in the future, or whatever. So really, I like the idea of that challenging that hierarchy a little bit.
Well, certainly the hierarchy is something that is prevalent in any business.
Mm,
Um, the difference in healthcare is the traditional hierarchy that you speak of is flipped right upside down,
mm,
right? The pyramid or the tree is large at the top with the direct care staff, the line staff, as you will. They're the top, and
mm,
the narrow end, or the bottom, is really made up of those uh, leaders or management positions that are there to be servant leaders and support, uphold, and really be there as a support mechanism. That's
sure.
how healthcare works, because those people, those folks that are frontline and hands on, they're the ones that are delivering the care. They're the ones that are receiving the information firsthand,
Mm-hmm.
having the touch, both physical and uh, just kind of first line
Proverbial.
touch.
Yeah.
Yeah. So there must be a level of trust there,
Yeah.
um, for the
Yeah.
facility to operate properly.
I love what you said about the idea of turning that hierarchy upside down to give people who traditionally are a marginalized population in lots of settings, and lots of using lots of different lenses, but to give people who are on those front lines, the people who are maybe in dietary, make sure I've got it right, but the people who are maybe working in dietary and housekeeping, as well as our CNAs and our nurses, to really give everybody sort of this idea that just because I have director in my name doesn't mean that I always have the best ideas, that I know the best way to do something, but that I really want to hear from the people who are really, as you said, very hands-on. Did I capture that right?
You did. I think that perfectly lends itself to the third idea that we discussed, and
Yeah.
that's developing a value statement for
Okay.
each individual that's
Sure.
working and is involved in the community. Uh, I almost hesitate to say or put director or manager or any of those other titles in front of some of the folks, because I really have always thought of driving that thought process, that the value that those frontline workers, the CNAs, the nurses, the dietary staff, the activity staff, the maintenance, I mean, the plant management, all of these folks,
Yeah.
they have to, or what the management can do is assure that they understand just how valuable and what that value is that they bring to the community,
Sure.
um, so that they understand how impactful they really can be if they're not being impactful, and that's both negatively and positively.
Yeah. Yeah, absolutely. Absolutely. I think that, so all of our three bullets, our three big ideas we're talking about them all at the same time, which is perfect. And we'll hit back on them again too. But, I think that also really ties to this idea. We've heard about this. I mean, I don't know about you, but in lots of places I've worked and been a leader in, and as well as a, not leader, there's this idea of that open door policy. And you talked a little bit about that, but I wonder if you can talk a little bit more about this idea of making sure that we are not just transparent with people, that people are bringing their issues, but that when there is a problem with somebody's performance or their work, and there is like a need for discipline, what that might translate to in terms of building that trust or keeping the door open and things like that.
Sure. Well, it the open door policy within itself is just vital. It goes hand in hand with the old management tool, the walk around management tool, which is prevalent in long term care, or should be prevalent in long term
Hmm.
care. But
Hmm.
if this conversation is to be in the proverbial office and the door is open, um, there's a few aspects there, right? Is number one, you have to be transparent. You have to, once you've accepted that information and you've had that, spent the time with the individual that's come to you, um, there has to be some action that follows behind it, especially if it is they're bringing forth an issue that could be a culture killer within the facility.
Right.
Non-action is almost worse than the wrong action, because you're accepting without executing on a decision or an idea or a plan to fix the problem. You're almost saying that you accept that as being
Yeah.
true within the facility, and
Yeah.
you're okay with it continuing, and that the non-action can almost be worse.
Absolutely. Absolutely. I totally agree with you. I just put that in the chat as a highlight because I think it's so important. Okay. So, I think so. We've talked a bit about ways that we can really foster building a positive culture within the permanent staff of a building. But we all live in the real world. We all know that finding, keeping an adequate number of high quality, awesome staff members is a challenge. And so the reality is that there will be contingent staff or temporary staff, and I'm going to use those terms interchangeably,
Mhm.
that come into a building. You know, one of the things that IntelyCare that we really strive very hard to do, as I know you know, is to really make sure that all of our workers, we call them IntelliPros, understand that they are going as a guest into somebody else's environment, and that they, of course, all the things need to show up on time, you know, answer to all of the policies and procedures that exist in that facility. But we also have their back a little bit when or if there's a challenge, right? We have all sorts of education to redevelop or remind or retrain if and when there might be an issue that happens in a facility. But I wonder if you might, from the facility perspective, and this is, you know, this is for, again, a post-acute care facility. This could be any facility. How do we sort of help enmesh the temporary worker, the contingent worker, in with this culture that you've worked so hard as a leader at the facility to create?
Sure. First, I'd point out that there needs to be a plan, right? Like this
Mm,
can't be. What we need to break is the cycle of, as a facility operator or owner, is wait until there's a problem and
yeah,
then try to fill it, and then try to fix it, patch it, put your finger in the dike,
yeah,
rather than have a thought out plan, which is something that, you know, IntelliCare is able to work with the facilities on. But
yeah.
to have a thought out plan where we are prepared, because we do know the world that we live in has had to open up to the adjustments of
Mhm,
the caregivers and the providers. We call them IPs, but the
mhm.
providers that work within these facilities, and the way that they want to work with with our residents. So we need to have a plan. We need to have a plan that allows the residents and the family members to understand that having contingent staff in the building will not lead to a deterioration in the care,
That's
and
important.
be able to explain that plan and how you're going to execute on it. The
Yeah.
other thing is the facility really wants to look at the ways in which you talked about being a guest, right?
Mm,
So if we're going with that analogy, the facility has to be ready to welcome in the
mm,
needed staff members
mhm,
and assure that they feel comfortable, they
mhm,
feel informed, they
mhm.
feel safe, and that they are gladly there, appreciated to be there, and you're going to help them get through the first minute, 10 minutes, first hour of their shift so that they're ultimately as productive as they possibly can be. So that's a two-way street, right? The
Yeah.
facility does have or should have a part in that. And
Mhm.
there's some pretty simple ways in which they can accomplish that.
Yeah. Oh, well, I'd love for you to tell us more about that. Don't leave us hanging. I want to hear more about how we can really facilitate that two-way street. That the temporary workers coming in, ready, prepared, understands that they are coming into a place where they are needed and wanted, but also understanding that they have a responsibility to understand that building, and that the building has a desire and want for them to be there too. So, can
Sure.
you tell us?
Sure. And really, these are simple things that can be done. Number
Yeah.
one is change a shift. Let's have
Mm,
the leadership. Let's have the unit managers. Let's have, if the administrators, the DONs, all the leadership should
mhm.
be out on the floors welcoming these folks in.
Awesome.
It's a great way to, within a minute or two, smile, have a nice interaction, and maybe even get into some of the culture highlights that you'd like to make sure that they understand right off the bat.
Yeah.
Whether it's a functional thing like we don't allow cell phones on the floor, all the way up to something, and I really hesitate to say simple and not as impactful, but maybe it's we don't call our residents honey and sweetie. We call them
Mm,
by their first names. But there's a second component of that. If that's the case, then please make sure that you have detailed group lists with the proper residence names, the proper residence room numbers, so
Mm-hmm.
that contingent staff member can have the information. And that leads into having a simple, quick 10-minute orientation sheet that shows the staff members where the DME is, where the durable medical
Mm-hmm.
equipment is, where
Mm-hmm.
the supplies are, where
Mm-hmm.
the units are, things like that.
Yeah.
The
Yeah.
other thing is maybe having a buddy system. If you have CNAs, or if you have any staff members that are long-term staff members, you might want to pair them up. So a little bit of a thoughtful process that takes not a lot of resources to put together will
Mm-hmm.
have a tremendous impact, because at the end of the day, a goal that I would have always strived for, and I would love for all communities to strive for, is for there to be no difference. So
Oh,
no discernible difference between a contingent staff member, a contracted vendor,
yeah.
and the internal staff to the residents and the families.
Yeah, I think that's a really important point. And, sort of to maybe add on to that a little bit, is that, as from the facility perspective, you're always marketing your building, right? I've heard you say that
Right.
before. You're always marketing your building, that we have this capacity and capability to take these temporary staff. And if we, as the building, make a great impression on them, maybe they'll want to come work for us full time. And as the worker, like, you're interviewing maybe for a job at this place by your performance on that shift.
Absolutely, it's a two-sided environment there. It's a two-way
Yeah.
street,
Yeah.
and you really are, from a facilities perspective,
Yeah.
you're marketing your facility in every aspect, in every
Yeah.
moment.
Yeah.
And one of the ways that, I know that we're focused on it here at IntelyCare, but one of the things that we're focused on is getting to a balanced workforce.
Right.
And in a particular community, long-term care, subacute, post-acute, or acute, the ability to do the temp to perm options
Mm-hmm.
is really just an extended job interview.
Mm-hmm.
So if the worker, if the caregiver feels comfortable and likes what they see, he or
Mm-hmm.
she sees, they're more inclined to inquire about staying on. And if the facility likes what they see, and if both sides have given them a chance for ultimate success,
Mm-hmm.
there's a very strong likelihood that you can make a match.
Yeah.
And in our case, that's something we're looking for, because there's a whole population of the workforce that we find, when we've done some of our research and some of our surveys. It's actually funny. It actually comes down to about a third, a third, and a third.
Mm.
If you look at, we survey over 700,000 IPs throughout the year, and a
Wow.
third of them do want to work full time.
Mm.
So making that match is an excellent way to get this accomplished.
That's terrific. That's wonderful. I had no idea that we survey that many people. That's wonderful. I just learned something. All right, awesome. Well, I'm noticing our time, and I want to be mindful of everybody's time.
Yes.
And so I wonder if there's, in a very fast moment, anything else you might want to say, and then I'll sort of wrap up. Again, if you have questions, though, I'm going to just say at this moment, if you have questions, definitely email us, or we're both on LinkedIn. You can certainly check us out there, or wherever you find us. So, any last thoughts,
Sure.
Sean?
My last thoughts would be this. Um, there are a lot of great resources out there.
Mm-hmm.
Going back to one of our first points, the communities are operating on razor thin margins. So
Mm-hmm.
finding the resources and the tools to best accomplish some of the goals that we're looking to accomplish, which is staff retention, um, is they're out there. Whether it's us, whether it's somewhere else, please go search for them and see what's out there.
Wonderful. All right. Terrific. So again, in closing, the idea is that you can make simple and meaningful steps to improve the quality of care provided to your community members, as well as to the individuals who might be working for you. I am so glad you are all here. Thank you so much for joining us. We can't wait to see you at the next event, July 31st. So stay tuned, check your email for that. Can't wait to see you in the second in our series. Have a great day,
Thanks so
everyone.
much.
Bye-bye.